8 alarming causes of toe pain and swelling. What your feet are trying to tell you. Have you ever woken up with toes so swollen and painful that even the touch of a bedsheet feels like torture? Or struggled to fit into your favorite shoes because your toes suddenly resemble little sausages? You're not alone. Studies show that over 75% of Americans experience foot problems at some point in their lives, with toe pain being one of the most common complaints. First on our list is gout, historically called the disease of kings, because it was associated with rich foods and alcohol. But here's the truth. Gout affects people from all walks of life, with more than 8 million Americans suffering from this excruciatingly painful condition. Gout occurs when uric acid builds up in your bloodstream and forms sharp, needle-like crystals in your joints. The big toe joint is the most commonly affected area, becoming red, hot, swollen, and so tender that even the weight of a bedsheet can cause unbearable pain. Extreme tenderness where even light pressure is unbearable. Shiny, stretched skin over the affected joint. Diets high in purines, found in red meat, seafood, and beer. Family history of gout. Medical conditions like high blood pressure, diabetes, and obesity. What makes gout particularly concerning is that without proper treatment, these painful episodes can become more frequent and eventually lead to joint damage and kidney problems. Next up is a condition many dismiss as merely cosmetic but can cause significant pain and disability. Bunions, or hallux valgus in medical terminology. A bunion is a bony bump that forms at the base of your big toe, when the big toe pushes against the next toe, forcing the joint of the big toe to grow and stick out. This misalignment causes the toe to point inward, sometimes even overlapping with other toes. Initially, just a bulging joint at the base of the big toe. Gradually increasing pain with pressure. Restricted movement in your big toe. Persistent swelling and redness. While tight, narrow shoes can certainly contribute to bunion development, many people don't realize that bunions often have a genetic component. Your foot structure and walking pattern, inherited from your parents, can predispose you to bunions regardless of your footwear choices. This condition affects approximately 23% of adults aged 18 to 65 and over 35% of people over 65, making it one of the most common foot deformities. Third most common cause, hammer toe. Moving on to another toe deformity that causes significant pain, hammer toes. Unlike bunions that affect the big toe, hammer toes typically affect the second, third, or fourth toes. Hammer toes occur when the middle joint of a toe bends downward, creating a claw-like or hammer-like appearance. Initially flexible, these deformities can become rigid and permanent without intervention. Symptoms that progress to hammer toes are fourth corns and calluses. Corns and calluses develop on top of the bent joint. This leads to pain when wearing shoes. Pain even while walking barefoot in advanced cases. Our fourth condition is often misdiagnosed because it doesn't show visible external signs. Morton's neuroma, sometimes called a nerve tumor, although it's not actually cancerous. Morton's neuroma is a thickening of tissue around a nerve that leads to your toes, most commonly between the third and fourth toes. As the nerve thickens, it becomes compressed and irritated, sending shooting pain through your toes. Morton's neuroma affects women 8 to 10 times more frequently than men, largely due to footwear choices. Those who regularly wear high heels, participate in high-impact sports like running and tennis, or have certain foot deformities are at increased risk. The pain from Morton's neuroma can be so debilitating that it significantly impacts mobility and quality of life. Yet many people delay seeking treatment because the condition isn't visibly apparent. Now let's talk about the fifth cause of foot pain, although it is the lesser-known cause of toe pain. Sesamoiditis. This condition involves bones you might not even know you have. Sesamoiditis is inflammation of the sesamoid bones, two small pea-shaped bones embedded in the tendons beneath the big toe joint. These tiny bones act like pulleys, helping the tendons move the big toe. This condition is particularly common among ballet dancers, runners, basketball players, people who frequently wear high heels, those with high arches. What makes sesamoiditis particularly challenging is that these tiny bones have limited blood supply, meaning they heal slowly and may require extended periods of rest and treatment. Sixth in the list is the condition called turf toe. Though the name suggests it only affects football players, it can happen to anyone, and it's more serious than most people realize. The turf toe is a sprain of the main joint of the big toe, the metatarsophalangeal (MTP) joint. It occurs when the toe is forcefully bent upward beyond its normal range of motion, damaging the ligaments surrounding the joint. Often occurs when the forefoot is fixed on the ground and the heel is raised. You feel sudden pain and swelling at the base of the big toe. Our seventh cause of toe pain is probably the most common: ingrown toenails. While they might seem like a minor nuisance, they can lead to serious complications if neglected. Ingrown toenails occur when the edge of a toenail grows into the surrounding skin instead of over it. The big toe is most commonly affected, though any toe can develop this painful condition. Ingrown toenails are particularly concerning for people with diabetes or circulation problems, as minor infections can quickly escalate to serious complications, including tissue death and even amputation. Our final condition, eighth one, is actually a symptom of potentially serious underlying health issues: peripheral neuropathy affecting the toes. Peripheral neuropathy occurs when the nerves that carry messages between your central nervous system and the rest of your body become damaged or diseased. When it affects the nerves in your feet and toes, it can cause significant pain and altered sensations. Numbness or reduced sensation in your toes. Tingling, burning, and prickling sensation. You may also feel as if wore socks while walking without slippers. Muscle weakness or lack of coordination are other symptoms of neuropathy. What makes neuropathy particularly dangerous is the loss of protective sensation, which means you might not notice injuries or infections in your toes until they become severe. If you found this information helpful, please give this video a thumbs up and subscribe to the Pain Story channel for more in-depth health explainers just like this one. We're on a mission to help you understand and manage pain from head to toe, literally.